Palliative medicine is a specialist branch of medicine for treatment of advanced stage illness, that's illnesses which are not curable and as a result shorten a person's life. Palliative means the easing of symptoms to enable people to live as well as possible. You will be referred to a doctor in palliative medicine if you need treatment for symptoms of your illness. GPs and specialist doctors will assess your symptoms and advise medications and work closely with your practice and other healthcare professionals involved with your care. They can review and treat other medical conditions that you may have because of your illness. This may prevent the need for you to go to the hospital for a medical problem because you can either be treated at home or if you need an admission, you can be admitted to a hospice for treatment. One of the common symptoms that you may experience in an advanced stage illness is pain. Pain can be treated with medications as well as non-medical treatments like complementary therapy. Morphine is an opioid medication and is one of the most common painkillers used for treatment of pain in an advanced stage illness. Morphine is a very effective painkiller, and your doctor may recommend morphine after assessing type of pain you have. It would only be given to you on prescription. When you take morphine for a medical reason like pain, it is not addictive and you do not develop tolerance. Your GP and palliative care doctor will also treat other symptoms. At times, you may see that a medicine used for another medical condition is used for treatment of your symptoms. For example, amitriptyline, a common medication used for treatment of depression, is used for nerve pain, and haloperidol, a medication used for mental health condition, is used for treatment of nausea and vomiting. Breathlessness is another symptom that you may experience if you have an advanced stage illness. You may be prescribed morphine in a low dose for treatment of breathlessness. Your palliative care doctor may also advise non-medical treatments like breathing exercises. Sometimes you may need treatment of the underlying cause for your symptom of breathlessness, for example, antibiotics for chest infection or water tablets for heart failure. Depending on your condition, you may also be prescribed steroids to improve your appetite or to reduce fatigue and general weakness. There are a few emergency situations in palliative care for which your doctor will send you to a hospital specialist for urgent treatment. One such situation is weakness of legs caused by cancer pressing on the spinal cord, which is called spinal cord compression. Most people associate palliative care with cancer, yet palliative care doctors can treat and support you through a wide range of medical illnesses from advanced heart or lung conditions through to neurological conditions like motor neuron disease. In brief, if you have a medical illness that has passed the curative phase and is impacting on the activities of your daily living, then your doctor will refer you to a palliative care doctor. Sometimes, palliative care doctors work closely with other specialist doctors or surgeons while treatments are still taking place to cure your medical condition. This means your palliative care doctor can also help you even though you may be cured of your illness. Palliative care doctors are not only trained to treat physical symptoms, but are also trained to provide psychological, emotional, and social support you and your loved ones may need and refer you to other healthcare services as needed. Palliative care doctors focus on treating people holistically to improve their quality of life by managing pain and other symptoms. They work as a team with other healthcare professionals that may include nurses, physio and occupational therapists, pharmacists, social workers, and sometimes volunteers. This team is called Specialist Palliative Care Team. Palliative care is for all people in the community, irrespective of their religion and cultural background, color of skin, language spoken, sexual orientation, known disability, or if a person is homeless. The medical treatments suggested by the palliative care doctor will not get in the way of your religious and cultural beliefs. All clinicians involved in your care will respect your individual background and wishes and will recommend evidence-based treatment on discussion with you and your loved ones. This is an overview of how your palliative care doctor can help you in your illness. If you have any questions about referral to a palliative care doctor, please do not hesitate to ask your doctor or your specialist.